Hey nurse champions! Chest flutters, a skipped beat, maybe a soft whooshing sound on a routine checkup. These can all point to mitral valve prolapse or MVP, a surprisingly common heart condition that's usually harmless but sometimes requires close monitoring. Today we're diving into what MVP is, when to worry, and how nurses can help patients manage it with confidence and clarity. The mitral valve separates the left atrium and left ventricle of the heart. In mitral valve prolapse, one or both valve flaps bulge or prolapse backward into the atrium during systole. This may allow a small amount of blood to leak backward, called mitral regurgitation. MVP affects about 2 to 3% of the population, often discovered incidentally. Most patients are asymptomatic, but some may experience palpitations or fluttering heartbeat, chest pain, which are non-cardiac in origin, fatigue or dizziness, shortness of breath, especially with exertion, anxiety or panic-like symptoms. On auscultation, mid-systolic click with or without a late systolic murmur. MVP is diagnosed by echocardiogram, which shows leaflet movement and degree of regurgitation. Electrocardiogram or ECG to assess for rhythm changes. Holter monitoring if palpitations are frequent. May be linked to connective tissue disorders like Marfan or Ehlers-Danlos in some cases. Management and nursing care. Most MVP cases are benign and require only periodic follow-up. Lifestyle adjustments include stay hydrated, avoid stimulants such as caffeine, nicotine, manage stress to reduce palpitations. Medications include beta blockers for palpitations or chest pain, anticoagulants if atrial fibrillation develops, antibiotics no longer routinely recommended for dental work unless high risk, surgical valve repair or replacement for severe mitral regurgitation causing heart failure symptoms. Monitor vitals, especially HR, BP, and rhythm. Teach patients to report new or worsening symptoms. Reinforce follow-up echocardiograms as ordered. Support patients experiencing anxiety. Many symptoms can mimic panic attacks. Educate about activity tolerance, hydration, and when to seek urgent care such as worsening SOB or palpitations. Patients need reassurance, clarity, and education, not fear. Mitral valve prolapse might sound scary, but with the right monitoring and nursing support, most people live full, healthy lives. Have you taught a patient about MVP? Share your favorite teaching tip in the comments. Like, subscribe, and follow for more cardiac care made simple and actionable by nurses for nurses.